My name is Edith Green, and today I'll be taking you through a presentation on care of the older adult. Medicare STARS program. There are several national programs that measure the quality of health services. Advantage Care Physician participates in many of these programs. One important program that ACP participates in is the HEDIS program. This program measures performance and important dimensions of care and services that are provided to our patients. This presentation will focus on one particular HEDIS measure, care of the older adult. We will review background information on this program as well as updates that have been built in EPIC to aid in the proper documentation of this measure. Care of the older adults is comprised of two components. First, it's managing chronic conditions, and second, our health outcome survey. Care of the older adult. This measure looks at our patient population 65 and older who had each of the following documented during the measurement of a calendar year. Assessing a patient's pain level, functional status, medication review, and advanced care planning will ensure that our older adults receive comprehensive care that further prevents health status decline while considering their wishes. I'm sure that you remember discussing the importance of this HEDIS measure during your care team meetings earlier this year. EPIC enhancements has been built to support completing these screenings and reporting for COA and HOS survey. Again, these screenings only have to be completed once per calendar year for our patients that are 65 and older. When patients 65 and older present to the Office for Care, you will see an additional tab in the rooming activity. This is where you can access the activities of daily living screening and health outcome survey questions that need to be completed for the year. Follow the routine rooming process and be sure to complete pain assessment, ADL's COA, and medications review. During the rooming process, we are already capturing a lot of information that is pertinent to reviewing the needs of the older adult patient. However, please remember that assessing our older patients for pain is an important part of us caring for the older adult. Whether or not a patient reports pain, documenting their pain level during the rooming process will help in our total assessment of this population. Pain assessment is found in the vitals section of the rooming activity. We will now go through the workflow of obtaining this information. In this scenario, Mr. Smith reports some pain in his left knee. He rates the pain as a 3 out of 10 and states the pain comes and goes. Utilizing the pain scale in the vitals section of the rooming activity in EPIC is the most efficient way to document this information. During rooming, in addition to documenting Mr. Smith's vitals, watch as I document his pain score, frequency, and location in the pain assessment section. Next, I will perform an ADL screening. Before performing the ADL screening for your patients 65 and older, explain to them why you are asking these questions. Let them know that you'll be asking them a series of questions that will help you and their provider understand how well they are getting along on a day-to-day basis. When performing an ADL screening assessment, ask probing questions to ascertain the appropriate selection to be made. For instance, Mr. Smith, do you currently live at home, alone, or with someone? If they say, I don't live at home, ask them how to explain where they live. Mr. Smith, how do you manage your housekeeping at home? Mr. Smith, do you normally prepare your own meals? After filling out the appropriate answers, based on the patient, an ADL score as well as an ADL total function will compute. I will now proceed to the care of the older adults section. Before completing this section, explain to your patient that these questions will give the provider further information on their potential needs. In assessing COA, please note the following. Advanced directives gives instructions to healthcare providers as to what type of supportive measures the patient wants in the event that they need to be hospitalized or become acutely ill. Make sure to discuss and assess your patient's urinary incontinence risk and report to providers so that he or she can develop an appropriate treatment plan if necessary. Ensure your patients understand the importance of managing their urinary incontinence. Continuously monitor your patients for risk of falls. Providers can give appropriate treatment plans to address balance, walking, and to avoid future risk of falls or fractures. Please report all negative findings to the patient's provider. Watch as I document Mr. Smith's COA information. He has an advanced directive. He does not feel that he's at risk for falls. He does not have an issue with urinary incontinence. However, he has some concerns about his physical activity, which is limited due to the occasional pain in his knee. Next, I will review the patient's medications. Although we perform medication review on all our patients, it is especially necessary and important to assess this in our older patients. Additionally, the documentation that a patient is not taking any meds is also important. Mr. Smith confirms that he is taking his lisinopril and simvastatin, but he stopped taking the multivitamins since it's not covered by his insurance. I will document this information by marking the medications as taking or not taken and click Mark as reviewed. The provider must be notified after completing an ADL or COA assessment. To notify your provider that ADL COA was completed without any concerns, open the Notes Activity tab. Inside the note, type COA completed. Click Accept. If you have some concerns after completing a COA assessment, for example, if a patient is at risk for falls, then the provider should be notified and the phrase COA concern should be documented in a note. Please note that once COA screenings are completed, a charge will be triggered in the charge capture section of the wrap-up activity. Thank you for viewing this video on the care of the older adult. We hope you found this helpful. For any further questions, please call the ACP Support Help Desk for assistance.